Hi, I'm Brooke Keller, and I'm going to talk about dissociative disorders. The history of dissociative disorders is really interesting and extremely controversial. It began with the belief of possession and other supernatural interferences, and the 1980 version of the DSM led to diagnoses of schizophrenia that may have been dissociative identity disorder. A number of influential scholarly articles inspired interest in the psychiatric community. Biological characteristics. Early trauma has been associated with smaller amygdalar and hippocampal volumes. Some of the symptoms of dissociation are significant memory loss, out-of-body experiences, or the sensation of watching one's life pass, depression, anxiety, detachment and emotional numbness, and lack of self-identity. The types of dissociative disorders are dissociative amnesia, depersonalization disorder, and dissociative identity disorder. Dissociative amnesia is temporary loss of recall memory, which can be for seconds or years, and a loss of autobiographical memory. This information is generally contextual and associated with trauma. The symptoms of dissociative amnesia include the inability to recall autobiographical memory, which causes distress and does not have physiological cause and is unrelated to dissociative identity disorder or substance abuse. Some of the characteristics of dissociative amnesia are forgetting personal information like trauma and stressful events, and it can occur in conjunction with other personality disorders like multiple personality disorder. Depersonalization disorder is an alteration in the experience of self, and seems as if one is an outside observer of one's outside mental processes or body. Some of the characteristics of depersonalization and derealization disorder are feelings of detachment, feeling like an observer to one's life in regard to feelings, thoughts, body, or actions. A person's perception of time and self are altered. They may experience feelings of numbness, physically, emotionally, or both, and they experience reality different than others. Dissociative identity disorder is characterized by the presence of two or more identities or personality states. This is an involuntary escape from reality characterized by a disconnection between thoughts, identity, consciousness, and memory. This affects the person's relationship to the environment and self. The DSM diagnostic criteria for dissociative identity disorder is a discontinuity in sense of self and sense of agency. Alterations affect behavior, consciousness, memory, perception, cognition, and/or sensory functioning. Recurrent gaps in recall of everyday events, important personal information, and/or traumatic events that are inconsistent with normal forgetting. Symptoms cause a person distress or impairment in important areas of functioning, like at work or in different social settings. Behaviors are not social norms or part of a religious practice, and they aren't related to other medical conditions or drug use. Someone with dissociative identity disorder may engage in antisocial, aggressive, and deviant behaviors like stealing or setting fire to things. They may experience hearing voices or having words controlled by other personalities. And people with dissociative identity disorder typically report significant periods of amnesia or blank spells. Someone with dissociative identity disorder may create alters, formerly known as alternate identities, which are different personalities with distinct characteristics and functions. An alter may be created after a traumatic event occurs to take on a victim role, which allows the host personality to escape into the protection of psychological oblivion. Some examples of alternative identities that may be created are a big brother or big sister, someone whose role is to protect the host personality. In this case, an adult with this alter may speak or act childlike. Another kind of alter that may be created is a persecutor identity. This character may inflict pain on other personalities through self-deprecating behaviors. They may engage in dangerous behaviors, and they believe that they can harm other personalities without harming themselves. Theories regarding the causes of dissociative disorders are associated with extreme trauma. This may include prolonged physical, sexual, and emotional abuse or emotional neglect as a child, exposure to natural disasters, participation in combat, and repression of trauma. Psychotherapy is used to treat dissociative disorders. Cognitive behavioral therapy helps reconstruct negative thinking. This helps a person identify negative thoughts and learn coping techniques. This method of therapy helps improve behaviors associated with depression. Dialectic behavioral therapy helps a person overcome destructive urges. This helps a person improve their relationships and regulate their emotions. This kind of therapy encourages the practice of different mindfulness techniques, like meditation. Eye movement desensitization and reprocessing therapy is supposed to help alleviate distress associated with trauma. It combines visual stimulation with techniques of relearning thought patterns, essentially replacing negative beliefs associated with trauma with positive beliefs. Some of the controversy centered on dissociative disorders is a result of the lack of concrete information. For example, between 1 and 6% of people have been diagnosed with dissociative identity disorder. Also, the 1980 version of the DSM led to diagnoses of schizophrenia that may be classified as dissociative identity disorder today. Finally, verifying reports of amnesia is very difficult because information and memories may be transferred between different alters.